We're going to talk some about cutting-edge research in terms of cannabinoids and PTSD. And we're going to start with the role of fear extinction in anxiety disorders. So phobias, PTSD, and other anxiety disorders share an important characteristic. I've mentioned this before. And that characteristic is a conditioned fear response. So that usually takes place to a stimulus that's not actually dangerous or threatening. So, for example, it could be going shopping at the grocery store, driving on the interstate, flying in an airplane, but has been conditioned to an actual dangerous stimulus, right? Connected to an actual threatening stimulus. So to study this concept of a conditioned fear response, we can easily create conditioned fear in animals, specifically in mice and rats. And I will illustrate that for you to sort of illustrate this concept of conditioned fear response. And so what we have here is we have our little mouse, and we have a conditioned stimulus, and then we have the actual fear stimulus. So we have a noise that it gets paired with foot shock. The animal gets shocked. It's like, yikes, jumps up. And then in the future, what happens is, even without the foot shock, if the noise is played, the animal shows a fear response. So how do we, this is, again, sort of generalizes to humans, how do we go about treating this conditioned fear? And the way we do that is with extinction paradigms. So fear extinction is basically a decline in the conditioned fear responses following exposure to a feared conditioned stimulus. In other words, after exposing the mouse to the tone over and over and over again without the foot shock, the mouse will eventually stop having a fear response to the tone. The same thing is true in humans. The problem that we have in using this approach with humans is that the extinction oftentimes does not last. So what happens is there's spontaneous recovery, which is basically a return of the fear response to the conditioned stimulus, even after undergoing the extinction procedure. So it comes back. Okay, so basically, because the exposure therapy has been proven, it is a first-line approach in terms of treating anxiety disorders, and relies on that process I just described. And the problem is, though, that many patients fail to maintain their treatment gain. So maybe this exposure therapy and extinction works, but then a week later or 3 months later, the conditioned fear response comes back. And so fear extinction is inhibitory learning, and its maintenance is temporary, and conditioned fear responses can return. So the term for this is that inhibitory learning is fragile. It's fragile, and basically it can come apart, and that conditioned fear response can come back. Now, how do cannabinoids impact fear extinction? Well, animal studies show that activation of the cannabinoid system during extinction learning enhances extinction and enhances, importantly, the retention of that extinction. And CB1 receptors are densely populated in areas of the brain that basically underlie fear learning and emotional learning. And so it makes sense that tweaking those CB1 receptors may impact both the effectiveness of extinction, but also how long it stays around. And then we also know that CB1 receptor agonists like THC can facilitate extinction and recall by preventing recovery of extinguished fear in rats. So there's some evidence in animals to suggest THC can impact this process. Now, what about in humans? Well, this is where it gets interesting, and I have a super cool interview with Dr. Christine Rabenak, who will talk more about her approach to this research, but what I'm about to tell you comes from papers that she's published over the last few years. So in this first paper, it was a randomized, double-blind, placebo-controlled between-subject design comparing THC to placebo in 29 healthy adults. And these adults underwent fear conditioning and an extinction paradigm, but received either THC or placebo before extinction. Compared to placebo, THC subjects showed lower fear responses to a previously extinguished stimulus 24 hours after extinction learning. Basically, what this work suggests is that THC prevented the recovery of fear. So, what about research questions and future directions? And so how do different cannabinoids or combinations of cannabinoids impact subjective and physiological measures of anxiety? That's sort of a very basic question, right? So CBD versus THC, are the effects differential? What are the effects for both of those? Most of the animal research uses CB1 agonists and not necessarily THC from cannabis plants. And so typically the human research and the stuff I just talked about is using dronabinol. Well, how might plant-derived cannabis impact anxiety and facilitate fear extinction? Is there any difference between the plant-derived cannabis and the synthetic? Well, we don't know yet, but that would be a good thing to learn. And then these are probably more important questions. So if ultimately this research suggests this works, well, what is the ideal dose? How long should treatment last? And across which populations would cannabinoids be most effective? For which populations might there be more risk? And finally, how can cannabinoids be integrated into other therapeutic modalities? So remember, we're talking about THC and possibly CBD impacting the effectiveness of exposure therapy. So it's the combination of those two things. Well, how do you integrate the two most effectively, right? Is it best for the cannabinoids to be taken before the session, during the session, after the session, both? And these are all important questions in terms of understanding how this works with respect to extinction.